Thank you for joining me today. In this video, we are going to learn more about psychiatric disorders and delusional disorders. Psychiatric disorders are disorders of a reality testing environment characterized by disturbance in thought content, like the delusion, perception disturbance, like the hallucination, thought organization, like disorganized thinking, behavior, motivation, and emotional experience. So clinical approach include symptom cluster, neurobiological diagnosis, antipsychotic selection, psychosocial rehabilitation, and safety monitoring. So we are going to go over the symptom cluster, neurobiological effect, diagnosis of psychosis, antipsychotic selection, psychosocial rehabilitation, and safety monitoring. So always we want to always evaluate if this psychosis is a primary psychiatric disorder. Is this psychiatric caused by mood disorder, like the bipolar disorder or mood disorder? We want to assess if this psychosis is caused by substance usage disorder. We want to also assess if this psychosis caused by medical diagnosis, because delirium is a confusion that is medical emergency. So we want to assess the symptoms and know the cause of the symptoms. Neurobiological of the psychosis include the dopamine hypothesis, muscarinic dopamine pathway increases dopamine activity that associated with hallucination, delusion, agitation, and the medication that we wanted treatment target include antipsychotic medications, D2 receptor blockers. Antipsychotic medication that is D2 receptor blockers, those are the treatment for increased dopamine with positive symptoms of schizophrenia or psychosis. If there is a negative symptoms of psychosis, mesocortical dopamine pathway lowers the dopamine activity, is associated with the negative symptoms of psychosis and cognitive impairment. And the example of that include social withdrawal, avoidance, blunt affect. Serotonin system is also affects the psychosis. It affects psychosis, mood symptoms, antipsychotic effect, So the treatment target include the secondary antipsychotic medication, SSRIs, secondary generation antipsychotic medication that blocks serotonin and dopamine. Glutamate dysfunction is that dysfunction contributes to cognitive symptoms, negative symptoms, and psychosis vulnerability. Positive and negative symptoms of psychosis include the hallucination, which is the positive, delusion, hallucination include the auditory hallucination, visual hallucination, tactile hallucination. Delusion is a fixed false belief despite the evidence. That's what delusion is. There is a persecution delusion, and the persecution delusion is I being followed. That is what they say. I being followed, I being targeted, somebody is going to kill me. Those are the persecution delusion. I have seen patients who are in a locked unit and they will tell you somebody is going to come here and kill me. Somebody is following me here. I don't feel safe, and they are running around. Even if you tell them there is a security in the door, even if you tell them they are in locked unit, even if you tell them they are in hospital, they still believe that somebody is going to persecute them. So they are in delusion, fixed, false belief, despite the evidence. No matter what you tell them, they have in those delusions of somebody is going to hurt them or follow them or kill them. Or I have patients who say gangs is going to come here and target me. You want to listen to the patient. It may be true, but even if that was true and somebody was following them, when they come to the hospital and they are locked unit and there is a security, there is a camera, they shouldn't be feeling that way continuously. So if they are feeling this false belief, that's delusion, because it's not reality. Also, there is a grandiose delusion, which is that they say, I have special power. I have special power that human beings don't have. So that is grandiose. Referential delusion. So there is a persecution delusion, grandiose delusion, referential delusion. Referential delusion is TV messages are about me. Let us say they are watching the news. The news is talking about me. This person in the TV is talking to me. So they think they are the anchor or broadcaster is talking to them directly. This news is for them. Somatic delusion include is my organs are abnormal. They think there is something wrong with their hand or something wrong with their arm or something wrong with their organ. erotomatic is a person is secretly in love with them. They think it's somebody, and it's not true. They think somebody is in love with them. That's one of the delusion. Disorganized thought symptoms include loose association, tangential speech, incoherent speech, disorganized behavior, negative psychosis. Negative symptoms of psychosis include loss of normal function. Negative means loss of the normal function, avoidance, reduced motivation, sadness, reduced ability to experience leisure, reduced speech output, flat affect, reduce emotional expression, reduce interest in relationship. So anything that's reduced normal function or loss of normal function is the negative psychosis of negative psychosis symptoms. Positive symptoms is abnormal is added abnormal experience of symptoms. Is when the person is a normal, and when you add abnormal experience, that is more, that is the hallucination. Hallucination is the false sense of perception. So that is added false to the perception. It's not normal perception, it's more than that. That's why it's positive. And delusion is more than belief. It's a false belief, so it's positive. Something abnormal and something lost is the negative. Cognitive symptoms of the psychosis include poor working memory, attention deficit, execution or executive dysfunctional, impaired process speech, so it affected their speech, their memory, their thinking, their thoughts are affected. If you want to assist the patient or the client, they need comprehensive psychiatric assessment that include psychiatric history. You want to assess if this psychosis related to age onset, how long did they have this psychosis, previous episode of psychosis, if they are hospitalized because of the psychosis that they are on, if they are on medication that caused them this psychosis, if they are risky to harm themselves or the others, avoidance risk, which is affecting them their normal function, to work, to study, to have a relationship, to go outside to exercise. You want to assist the decline function, how the psychosis affected their function. You want to assess the psychosis. You want to assess the how if they are hallucinating, how when they are hallucinating, what kind of hallucination is, how stressful is the hallucination. You want to assess the delusion, conviction of the delusion, impact of the how the delusion is impacting their function, how safety it is, or safety implication of the delusion that they have. You want to assess the thought process. You want to assess how the organization of the thought process, association of the thought process, speech pattern. You want to assess the medical. You want to assess, you want to rule out if they are having a delirium, if they have a thyroid disease, neurobiological or neurological deficits, or neurobiological disorganization, if they have an autoimmune system encephalopathy that's causing them the delirium or the confusion. You want to assess seizure, because delusion can lead to seizure, or when the person having a delusion, when they having a seizure, they begin having a delusion or psychosis, substance-induced psychosis. So seizure leads to psychosis. Psychosis also leads to delusion, because when person is withdrawal, like for example, alcohol withdrawal can lead to hallucination, delusion, and that leads to psychosis. They will go to psychosis, and that psychosis then will lead to seizure. So you want to assess seizure, you want to assess autoimmune disorder, neurological disorder, thyroid, delirium, what causing the psychosis. That's what you want to assess. Substance, you want to evaluate if they are in cannabis, if they had a cannabis, and that is they are withdrawal of the cannabis, and that is causing them the psychosis. You want to assess methylphenidate. Methylphenidate also causes psychosis. Marijuana causes psychosis. Cocaine causes psychosis. Hallucinogenic also causes psychosis. Steroid causes psychosis. Dopamine driven medication is causes psychosis. So you want to assess all that and rule out. You want to assess their mental status by assessing their appearance, if they are having a poor hygiene, if they are disheveled. You want to assess their behavior. Are they agitated? Are they going withdrawal? Are they guarded and scared? Speech, you want to assess their speech. If they are having a low speech, poor of speech, pressure speech, disorganized speech. Affect, you want to assess affect. You want to assess the mood and affect. Do they have mood, the affect? Are they having anxiety, depression for the mood? Are they having a withdrawal, flat affect, blunt affect without emotion? Do they have, you want to assess their thought process? You want to assess if they have a loose association, tangential, thought blocking. You want to assess the thought content, like delusion, paranoia, homicidal, suicidal, you want to assess all that. Perception, you want to assess hallucination, judgment, insightfulness and judgment, you want to assess if they are this impaired, if their judgment and insight is impaired. So medical, there is a medical and psychiatric causes for the psychosis. Mental psychiatric disorders that causes psychosis include schizophrenia. If they have a schizophrenia, which is a chronic disorder that involves positive psychosis and negative psychosis, cognitive impairment, decline function. Schizophrenia is a chronic that causes positive and negative symptoms of psychosis, impaired cognition, and decline of the function, daily function, work, school, activity, relationship, social engagement, all that is declined and it affected. Diagnosis, DSM-5 diagnosis criteria include two types. Patient has to meet two types to be either delusion or hallucination or disorganized speech to be diagnosed with schizophrenia. At least the person has to have either delusion, hallucination, or disorganized thought to be diagnosed with schizophrenia, and that has to last more than 1 month, equal or more than 1 month, that continue. Symptoms are effective 1 month or more, and that continue 6 months. And there is a functional impairment. So the person has either delusion or hallucination in a 1 month or more that continue at least 6 months, and then they have a functional decline that affect it. These symptoms affected their daily life, affected their school, work, relationships, social contact, their responsibility as a mother or father or son. That is how schizophrenia is diagnosed. Differential diagnosis to rule out include bipolar disorder, major depression disorder with psychosis features, bipolar with psychosis features, schizoaffective disorder, substance-induced psychosis, delirium, PTSD with psychosis, autism spectrum, the prognosis of schizophrenia is chronic, but some progress can be made. Better diagnosis is associated onset if good comorbidity function, mood stabilization, shorten of the duration of the schizophrenia. So the schizophrenia treatment target is to improve their function, to control the psychosis, to improve the mood, stabilize the mood. So diagnosis of the, as we talk about the core diagnostic challenges require mood episode plus schizophrenia. So mood episode and schizophrenia together is a psychoaffective disorder. Psychoaffective disorder combines mood disorder with schizophrenia disorder. And the DSM-5 treatment diagnosis criteria diagnosis require major mood episode and schizophrenia episode together, and at least 2 weeks of a psychosis without mood, or and 2 weeks of psychosis without mood. Okay. Treatment include antipsychotic medication, and the treatment goal is to target the acute psychosis, to stabilize the person, to improve the relapse, to improve the function, to prevent the relapse, to improve the function, to stabilize the person, to reduce the suicidal ideation. Those are the 4 target goals of the treatment. The 4 target goals of the treatment is to stabilize the person and target the acute psychosis and the symptoms. You want to stabilize those symptoms. You want to prevent the relapse of the person coming back to the hospital or experiencing the psychosis again. You want to improve the function of the person so they can work, they can go to school, they can have a relationship, they can function in the community. You want to reduce the SI and HI, homicidal and suicidal ideation. And the first treatment, medication treatment, is the first generation. There is a second generation of psychosis, second generation of antipsychosis, antipsychiatric medication. It's the quick stabilizer, but second generation is the preferable treatment. First generation, like Haldol, it to quickly stabilize the person, but it has also high risk of extra parameral symptoms like muscle movement. It causes symptoms, and those symptoms include acute dystonia, akinesia, parkinsonia, tardive dyskinesia. Those are extra parameral symptoms, or EBS. So first generation has a higher chance of this risk of having a EBS symptoms, but the advantage of the first generation antipsychiatric medication include acute psychosis stabilization and lowers the severe agitation, like Haldol. Second generation antipsychiatric medications, they block dopamine and serotonin, while the first generation of antipsychiatric medication, they are strong dopamine 2 blocker, so they lower the dopamine strongly, and that causes muscle rigidity and muscle stiffness symptoms. However, second generation antipsychiatric medication, they block dopamine, but they block moderate, partial, and they also block serotonin. Like a Risperdal is treat positive symptoms. However, the risk of Risperdal include hyperprolactemia, and EBA symptoms. It has a high risk of hyperprolactemia and EBS symptoms for higher dose. Palaperidol is also useful for schizoaffective disorder because it targets the mood and psychosis. Schizoaffective disorder is the psychosis plus the mood. So medication like the Invega treat both the mood and psychosis. The mood and the psychosis. And it's also long-acting injections that treat psychosis and is helpful for relapse prevention. Invega has that long injection medication. Clozapine or Cyproxa has a broad effect for the mood and psychosis. However, it has a risk of a weight gain, and that increases the diabetic and metabolic dysrhythmia, metabolic syndrome, not dysrhythmia, metabolic syndrome. It also increases the lipid, and that is weight gain, high lipidemia, high blood sugar, metabolic disorders. Seroquel is useful for psychosis. It stabilizes the mood also, and it controls the mood symptoms, so both the psychosis and mood symptoms. However, the risks include weight gain and sedation, and that is also, the sedation can cause confusion for elderly and risk of falls. Abilify is a partial dopamine agonist, Abilify, and Abilify has a lower risk of metabolic risk, so it don't increase the weight that much because it has a partial dopamine agonist, and it will not increase the diabetic, lipidemia, and metabolic syndrome. Abilify. However, Abilify causes akinesia. Akinesia is a muscle movement like the ABS, one of the ABS symptoms. Clozapine. Clozapine is the most effective for treatment resistant of a schizophrenia. It's a mood stabilizer and treats psychosis. It reduces the risk of suicidal ideation. However, it causes blood aganalosis. It lowers the white blood cell and it causes risk of infection. Neutrophilic, it causes a neutrophilic to be lower, and that causes the infection to, it will lower the immune system, it will lower the white blood count, and that causes infection because your body will be vulnerable to infection. It also causes heart muscle inflammation, myocarditis. It also causes seizure and severe constipation. So clozapine causes aganalosis, which is the lower of the white blood cell, neutrophilic, and myocarditis, seizure. It causes seizure and myocarditis and severe constipation. And aganalocytosis is a life-threatening blood disorder characterized by severe lack of white blood cell neutrophilius white blood cell, as we mentioned. So treatment, if the first episode of psychosis, first step is to confirm the diagnosis and rule out other medical causes. Next step is to start second generation antipsychotic medication like the Risperdal, Abilify, Clozapine, and Seroquel. You want to confirm the diagnosis first and rule out the medical causes. Second step is to start second generation antipsychotic medication such as Risperdal, Abilify, Clozapine, Seroquel. Second step is to monitor the response for the treatment for 4 to 6 weeks because the antipsychotic medication takes a long time to be effective. The fourth step of the treatment plan is if the medication is not enough or it's not treating, you want to either switch, you want to either increase the dose or add other medication or adjust the medication dose, switch the antipsychotic medication, or consider continuous if it's working. If it's working, you want to continue. If it's not enough, you want to increase the dose or add other medication. If it's not totally working or causing more symptoms you want to switch. Second step of the treatment include treatment for resistant Clozapine, and you have to monitor the blood, white blood cell for that. If the person is not compliant with the treatment, you want to consider long-term, long-acting injection antipsychotic medication. If the person is poor with taking their medication, if they are frequently relapsing, if they have a multiple hospitalization, you want to consider a long-acting injection of a antipsychotic medication, because that it will improve the medication compliance, because you are going to inject them. They will come to the clinic and they will get this injection for either 3 months, 6 months, depending on the type of medication. And if they are frequently relapsing and not taking their medication, you want to consider that long-acting injection of antipsychotic medication. If they are always hospitalized, if they are coming to the hospital and they had a multiple hospitalization, you want to consider that long-acting injection of the antipsychotic medication. These medication that have a long-acting injection include the Abilify, include the Raspadol has a long-acting injection. For bipolar disorder or schizophrenia, Abilify has an injection, long-acting injection of antipsychotic for bipolar and schizophrenia. Raspadol also have that long-acting injection. Invega is also has a long-acting injection for the schizophrenia and schizoaffective disorder. Raspadol injection is for also schizophrenia and bipolar disorder. So Abilify, you will choose either Abilify, Invega, Raspadol, depending on the diagnosis that the patient have. Antipsychotic medication is, there is a monitor guidelines for antipsychotic medication is, there is a baseline monitor, because antipsychotic medication, they increase the weight, they increase the blood pressure, they increase the blood sugar, increase the lipid, they affect the pregnancy, and they cause muscle rigidity or muscle movement, EBS symptoms. So you want to monitor the weight, you want to monitor the blood pressure, you want to monitor the lipid, you want to monitor the blood sugar, A1C, and fasting glucose. You want to monitor the symptoms of EBS, and you want to switch them if that is the, if if that is the case, you want to switch other medication that has less side effects. The ongoing monitor include the metabolic, like the weight gain, glucose and lipid assessment. That is the ongoing assessment, ongoing monitor. Also, the ongoing monitor include the neurological EBS symptoms, aim testing for the muscle rigidity, TEDF dyskinesia assessment. Also, they cause cardiac issue, they prolong QT, and that is arrhythmia and leads to heart failure. So you want to assess that cardiac vascular assessment. Major safety warning for antipsychotic medication include neuroleptic malignancy syndrome. Neuroleptic malignancy syndrome is a medical emergency that causes fever, rigidity, aerodynamic instability, mental health, alter mental status, like a confusion. And the treatment is you have to stop the antipsychotic medication and you have to stabilize the patient, medically stabilize the patient. First, stop the medication and then stabilize the person. If they are experiencing TEDF dyskinesia and the symptom is oral visual movement, they move their mouth and tongues, either they cannot close their mouth or they are chewing their tongues, they are moving their tongues or their tongues is stuck, involuntary movement. So the treatment, so the risk is long duration exposure. That is the risk factors. If they've been taking long time for antipsychotic medication, they have a risk factor of developing TD. If they are older, they have a risk factors. So what are the treatment? Treatment is to switch or reduce the antipsychotic medication. And then you want to prescribe a medication to like the Ingrisa. Some of the medication that improve is felbenzine, Astora, Exazine. Those are the medications that helps the TEDF dyskinesia. If they are experiencing with metabolic syndrome, you want to stop the medication or switch to other medication. Mostly medications that call metabolic metabolic syndrome. The medication that causes metabolic syndrome is Clozapine. Those are associated with the metabolic syndrome. So you want to monitor the weight, glucose, lipids. Psychotherapy integration. You want to integrate psychotherapy with the psychopharmacology. The first line of psychotherapy include the cognitive behavior therapy for psychosis, and that therapy targets the distress from the hallucination, improves the delusion. It helps them to have coping skills, family education, family psychotherapy helps the improves the education, improves and educate the medication compliant. It teaches the patient and the family relapse prevention strategy, also social skill training, help with the communication, community function, support employment, improves work, keeping the job, supporting the patient to keep their job or finding job that work with their ability. You wanted psychiatric rehabilitation that include housing, case management, ACT teams, work rehabilitation or training, lifestyle improvement. For the children and teenagers, you want to consider developmental disorder. You want to assess the trauma, substance usage or exposure, family involvement, lower dose of medication. You want to lower the dose because the children they need less dose of medication compared to the adult. You want to monitor metabolic disorders, pregnancy. For pregnant women, you want to consider relapse risks of a medication discontinuation, fetal exposure risks. You want to have the shared decision making. You want to avoid abrupt discontinuation without the risk and benefit assessment. For elderly, the high-risk medications include the psychiatric medication causes the fall, low blood pressure, or orthostatic blood pressure. It affected their cognition and causes confusion. Anticholinergic effect. They have anticholinergic effect. Dementia. So antipsychotic medication used in dementia increase the mortality. Treatment-resistant schizophrenia is the 2 times failed antipsychiatric trials. So the steps you want to take is you want to confirm if they are compliant with their treatment. You want to confirm their diagnosis. You want to assess and address the substance usage if they are using substance. And then you want to consider Clozapine. And then Clozapine is indicated for treatment-resistant schizophrenia and persistent suicidal ideation behavior because it treats both, and severe agitation. It lowers the agitation. treats agitation, it treats psychosis, and it treats suicidal ideation. So, first episode of psychosis requires medical and substance evaluation. Positive symptoms respond better to antipsychotic that have positive symptoms respond better to antipsychotic than the negative. So positive, if the person have positive symptoms of schizophrenia, they respond to the treatment better compared to negative symptoms of psychosis. Negative symptoms of psychosis are the major predict of a long-term disability. So if they have a negative symptoms, that is the predict of a long-term disability of the cognition, functional wise, integration of the community, working, going to school, it affects all that. It has a longer, it's worse than the positive. Clozapine is the most effective medication for treatment-resistant schizophrenia, and long-acting injection antipsychotic medication reduces the relapse to non-compliant patients. Always monitor metabolic effects of second-generation antipsychotic medication. Psychosis lasts less than 1 month, such as indicates brief psychosis disorder. Psychosis plus mood require carefully timeline assessment of schizoaffective disorder. So schizoaffective disorder is psychosis plus mood disorder. So we have a case study, and the case study is you have a patient who is hallucinating, who is having a delusional thoughts, who is disorganized speech for the last 8 months without functional decline. So the person is working, going to school, having a stable relationship, stable house, but they are still hallucinating, they are having a delusional thoughts, they having a disorganized speech. What is their diagnosis? What is the diagnosis if the person meets all that? That is schizophrenia, because they meet the criteria of delusion, hallucination, disorganized thought, even though they are not having a functional decline. That is schizophrenia. The next person we have is a patient who has psychosis and depression but has 2 weeks of psychosis without mood. They have psychosis and they have a depression together, but they have 2 weeks of psychosis, but they don't have the mood for 2 weeks. So there is a mood and there is a psychosis. However, they didn't have that mood 2 weeks, but they have a psychosis. What is the diagnosis? That is, since they have a depression and psychosis together, psychosis is a schizophrenia symptoms, or psychosis is a psychiatric disorder, and depression is a mood disorder. So if they combine those, that is psychoaffective disorder. Our third patient is person who is developing a fever. They have a fever, temperature. They have rigidity. They have confusion. They had aerodynamic instability after starting Haldol. They are taking Haldol, but they are experiencing these symptoms. What do you do? Because you give them Haldol because they are psychosis and you want to stabilize them, but they develop this fever, rigidity, confusion, and aerodynamic instability. What is the next step? This person may have neuroleptic malignancy syndrome, so you want to discontinue the medication and you want to provide emergency, medical emergency, and emergency treatment. We have the fourth patient. This patient fails two antipsychotic medication. You give them one psychiatric medication first, and then you assist them, follow them 4 weeks to 6 weeks, and then they fail that, and then you adjust them and you switch to different antipsychotic medications, and they still are not effective. 2 trials, 2 different psychiatric medications. What is the next treatment? What is the next medication you want to test? Because they already failed 2 different antipsychotic medications. You want to use Clozapine, because Clozapine, as we mentioned, treat resistant schizophrenia and suicidal ideation. Next, we have our fifth case study. We have patients who are fixated with prescriptive belief for 2 years, but otherwise functioning normally. What is the diagnosis? They believe this somebody is following them, but a scooter, delusional belief, but they had that delusional belief for 2 years. What is the disorder? What is the diagnosis? It's delusional disorder. So psychiatric disorder treatment requires integration of biological, like a dopamine. It requires of the integration of the dopamine, serotonin. It affects biological effects include dopamine, serotonin, glutamate dysfunction, and the diagnosis include the schizophrenia spectrum, mood-related disorders, substance-induced psychosis. Medications include antipsychotic selection and monitoring that antipsychotic medication. Functional decline include the decline of work, school, relationship, community. So you want to do the functional rehabilitation, employment, relationship. So you want a functional improvement. Safety, you want to consider the suicidal ideation, violence, medication adversary. Recovery, you want to concentrate the medication, psychotherapy, social support. Thank you for joining me today. I would love to see you in my next video. Please subscribe and join me again. Thank you.